was going back over the variables that determine where the position of the head is in relation to the atlas. And it needs to be centered correctly on the atlas. It needs to be brought to center. And Grandpa did talk about, well, he always told me right or left, and they're saying translated. I'm like, okay, I have to define translated. Grandpa never used the word translated. It's either slipped to the right or it's slipped to the left. And that's the head on top in relation to the center of the atlas. And it is also, at the same time, rotated either clockwise or counterclockwise. And if you have a rotation, you have a side slip. If you have a side slip, you have a rotation. It's just the way it is. It can be in different varying degrees, basically. But if it's not center, perfect center, it's going to have a tendency to slip. And once it starts to go, it's going to continue to slide. But he also talked about extension and flexion. So basically there were 6 variables, and that was in his documentation. And he didn't tell me a whole lot about it, but he was perfecting the method. And he basically told me, he said that based on the design of the actual ilano-occipital joint, the true design of it, that it's best when you make the correction, the adjustment, not just pop, not just manipulation or manhandling, it's actual placement to center, that you put the head back in extension, because the way the joint is shaped, it makes it easier to place it. That's what he said. But that is definitely, well, XYZ is what Johnson keeps saying, and I'm like, well, there it was. Grandpa talked about it. Right or left, rotated, clockwise, counterclockwise, extension, or flexion. So he got the idea, probably. Had to make it look like his own. I know he read Grandpa's articles. I know he had to. Some of the things he said, and I brought this to everybody's attention, to his attention, I'm sure, because I know he's looked in. The things that he said freaked me out. And he might have been one of the guys that shook Grandpa's hand when he was just a kid, wet behind the ears. I don't know. But he didn't have the time with Grandpa that I had. And Dr. Creighton, that is. And Dr. Creighton perfected the methodology of placing the affected bones, the actual bones that are truly, actually partially out of place in relation to the other bone in the joint, and that has to do with sacroiliac and ilano-occipital joints specifically, that's they're dabbling and they don't know how to do it right. I'm not about to, at this point in time, show cases like they show cases, because they try to duplicate it and not know what they're doing, and I guess they're already doing it wrong anyway, but they don't have the fortitude of character to, contact me and say, it works, here's your cut, oh, I want to learn more, No, they want to steal it instead. So, my 2 cents, once again. Anyway, Dr. Johnson needs to, quote unquote doctor, needs to either or come and learn it from me, pay his due, become legitimate, or he needs to send his patients in my direction. Because what's best for them is to have the affected bone placed back to, center, where it's articulating, as it should be with the other bone in the joint. Because once it is set there, once it's set, I always tell people, I can set it, I can't heal it. But once it's set there, and there's no damage to the joint, because it hasn't been eons of time with chiropractors, jerking it all around, which they're causing the problem. But, if it's a new injury, you set it, that's it. Go. You don't have to continue to come back, you got chiropractic care, for the rest of your life. No. Anyway, didn't come my way.